Why blood tests fail and why saliva testing works. Hi, I'm Dr. Eldridge Taylor, and if you watched the first video and you now understand that women's hormone physiology has been misunderstood for decades. Today we're going deeper into why, and specifically why the way we have been taught to test hormones simply doesn't line up with physiology. So let's get it straight. Fat-soluble hormones don't live in the blood. Estrogen, progesterone, testosterone, these hormones are fat-soluble. They don't float around freely in the bloodstream. They ride in something called hormone-binding globulin, sex hormone-binding globulin. I call it a FedEx truck. When you draw blood, you're measuring what's in the truck, but the truck doesn't tell you what actually got delivered to the tissue. Symptoms come from what reaches the tissue, not what's riding around bound in a carrier protein. This is Physiology 101. We all learned it, we just never applied it to testing. This explains 95% of the normal labs, but abnormal symptoms. That's the problem. A woman can have debilitating symptoms, irregular cycles, PMS, migraines, anxiety, insomnia, perimenopause, chaos, and her blood work will come back stamped normal. But the patient is not normal, and deep down you know it. We have all seen this in practice. The numbers say one thing. The woman sitting in front of you says another. This disconnect is why so many clinicians feel frustrated and confused or even powerless when trying to help women in perimenopause and menopause. Saliva testing measures delivery, not transportation. Saliva reflects the free, bioavailable, tissue-active portion of the hormone. It shows what actually made it out of the truck and into the target cell. This is why saliva correlates with symptoms. This is why saliva correlates with the response to therapy. This is why saliva changes the entire clinical picture. Once you see a saliva pattern, the symptoms finally make sense. Blood testing was never designed for what we use it for. In my residency, we never even thought about drawing blood to look at hormones. This isn't an attack on medicine. This is simply a realignment of physiology. Blood testing is excellent for thyroid, CBC, testosterone in men, but blood was never intended to guide hormone therapy in women. It's a mismatch of tool and task. When clinicians switch to saliva, several things happen immediately. Your diagnostic clarity increases, your confidence increases, your treatment plans simplify, your patient satisfaction skyrockets because the physiology finally matches the lab. This is also why I'm building the Beyond the White Coat education system. Clinicians are waking up, not just patients, clinicians. You want tools that make sense. You want patterns that match symptoms. You want to help women without guessing. That's what Beyond the White Coat provides. A physiology-first framework, saliva-based pattern recognition, practical interpretation tools, case studies, and streamlined protocols you can actually use. This is not new physiology. It's simply correct application of physiology. If this resonates, there's the next step. I've created a professional pathway for clinicians who want to learn the Taylor method. Add a hormone service line or strengthen what they're already doing. When you're ready to explore the professional track, you can go at your own pace or join the deeper mentorship pathway. And if you have questions, leave a comment here on ViewMedi or reach out directly. I'm Dr. Eldridge Taylor. Thank you for taking time to learn what women were never taught and what most clinicians were never taught either, including me. This knowledge has the power to change your practice and transform the lives of the women you serve and actually transform your life because it changed the course of my career 25 years ago. So I'll see you in the next video.